By raising your hand, how many of you know at least one of the person on the screen? Well, it's almost a full house. It's true, they are very famous in their field. And do you know what all of them have in common? They all died of pancreatic cancer. However, it's very, very sad, this news. It's also thanks to their personal story that we have raised the awareness of how lethal this disease can be. It raised to be the third cause of cancer deaths, and only 8% of the patient will survive beyond 5 years. That's a very tiny number, especially if you compare it with breast cancer, where survival rate is almost 90%. So it doesn't really come as a surprise that being diagnosed with pancreatic cancer means facing an almost certain death sentence. What's shocking, in the last 40 years, this has not changed a bit, while progress has been done for other types of tumor. So how can we make pancreatic cancer treatment more effective? As a biomedical entrepreneur, I like to work on problems that seems impossible, understanding their limitation and trying to find new innovative solutions that can change their outcome. The first bad news with pancreatic cancer is that the pancreas is in the middle of your belly, literally. It's depicted in orange on the screen, but you can barely see it until I remove all of the other organs in front. It's also surrounded by many other vital organs, like the liver, the stomach, the bile duct, and the ability of the tumor to grow into those organs is the reason why pancreatic cancer is one of the most painful tumor types. The hard-to-reach location also prevents the doctor to surgically remove it, as is routinely done for breast cancer, for example. So all of this reason leaves to pancreatic cancer patients as only option chemotherapy. This brings us to the second bad news. Pancreatic cancer tumors have very few blood vessels. So why should we care about the tumor? Let's think for a second how chemotherapy works. The drug is injected in the vein and it navigates throughout the body until it reaches the tumor site. It's like driving on a highway trying to reach a destination. But what if your destination doesn't have an exit on the highway? You'll never get there. And that's exactly the problem for chemotherapy and pancreatic cancer. The drugs navigate throughout all of your body. They will reach healthy organs, resulting in high toxic effect for the patients overall, but very little will go to the tumor. Therefore, the efficacy is so limited. To me, it seems very counterintuitive to have a whole body treatment to target a specific organ. However, in the last research and effort has gone to finding new powerful drugs to treat pancreatic cancer, but nothing has been done in changing the way we deliver them to the patient. So here, after two bad news, I'm gonna give you a good news, hopefully. With collaborators at MIT and the Massachusetts General Hospital in Boston, we have revolutionized the localized drug delivery a reality. We are basically parachuting you on top of your destination, avoiding you to driving all around the highway. We have embedded the drug into device that they look like this one. They are flexible enough that they can be folded to fit into the catheter so that the doctor can implant directly of the tumor with a minimal invasive surgery. But they are solid enough that on top of the tumor, they will act as a cage, physically preventing the tumor to enter into other organs, controlling the metastasis. The devices are also biodegradable. That means once in the body, they start dissolving, delivering the drug only locally, slowly, and more effective than what is done with the current whole body treatment. In preclinical study, we have demonstrated that this localized drug is able to improve of 12 times the response to treatment. That is already known, and by just delivering it locally where is needed the most, we allow a response that is 12 times more powerful, reducing the systemic toxic effect. We are working relentlessly to bring this technology to the next level. we are finalizing the preclinical testing and the animal model required prior to ask FDA for approval of clinical trials. Currently, the of pancreatic cancer, one day we can reduce their pain, extend their life, and potentially make it a curable disease. By rethinking, we don't only make them more powerful and less toxic, the door to find new innovative solutions for almost other impossible problems in pancreatic cancer space and beyond. Thank you very much.